Hi, my name is Melina Santos. I'm going to be doing my head-to-toe assessment here for Spring 2024 Health Assessment class with Dr. O. I'm going to first pan around and show my living space. These are all my belongings. Here's my patient. Here's the floor. Here's the ceiling. Okay. So first I'm going to begin my skin assessment by looking at the color of the skin, feeling the temperature of the skin, feeling for the turgor of the skin, which is nice and elastic. I'm feeling for any abnormal moisture, looking for scars, bruising, lesions, nevi, anything like that. I just noticed some moles on the upper arms and that's about it. So I'm going to start my head assessment by palpating the scalp. I'm going to be feeling for any depressions, indentations. Are you having any tenderness?
No.
Okay, perfect. The scalp feels symmetric. And then I'm going to be assessing the hair color, texture, and distribution, as well as looking for any infestations, which I don't see any. The hair is nice and dark, evenly distributed, and a soft texture. I'm going to begin by palpating the face, so let me know if you're having any tenderness, okay? So the frontal sinuses, the maxillary sinuses, any tenderness with that?
No.
Okay. Feeling for any bruise in the temporal arteries, any tenderness with that?
No.
Okay, perfect. Now we're going to be feeling the TMJ joint, so can you open and close your mouth a couple times for me? Okay, any tenderness with that? No subluxation or crepitus either. Now I'm going to be feeling the outer ears, the pinna, and the tragus. Any tenderness with that?
No.
Okay, perfect. I'm also looking at the position and the shape of the ears, which they look good. And now I'm going to be assessing the eyes, looking at the brows, the eyelashes, the pleural fissures. Everything looks normal and symmetric. I'm also looking at the nose, making sure it's midline and straight. And now I'm going to be assessing for nasal patency. So can you breathe in for me? Perfect. And now the other. Okay. But did you feel like they were equally patent?
Yes.
Okay, perfect. And now I'm going to be palpating the lymph nodes. So I'm going to begin with the occipital lymph nodes, the postauricular lymph node, the preauricular lymph node, the tonsillar lymph nodes, the anterior cervical lymph nodes, the posterior cervical lymph nodes, and the supraclavicular lymph nodes. Any tenderness with any of that?
No.
Okay, perfect. So now we're going to begin by assessing the cranial nerves. So beginning with cranial nerve number 1, olfactory. I'm going to have you let me know if you can smell this lotion, okay? Okay, what about that side?
Yes.
Okay, so cranial nerve number 1 is intact. We're going to be doing cranial nerve number 2, optic. So with the Snellen chart, I'm going to have you read this lowest line for me.
LTFPH.
Okay, perfect. So peripheral vision is intact. And now I'm going to test, central vision is intact. Now we're going to be doing peripheral vision. So cover your eye for me. And now let me know how many fingers I'm holding up, okay?
3, 2, 3, 2.
Let's try that again. Okay.
3, 2.
Now we'll do the other side.
2, 3, 3, 2.
Okay, perfect. So peripheral vision is intact, cranial nerve number 2, optic. And now we're going to be doing the cranial nerves number 3, ocular motor, 4, trochlear, and 6, abducens. So we're going to be testing the 6 vision fields as well as convergence. So follow your gaze only. Follow my pen with just your gaze. Okay, so convergence is intact and all 6 visual fields were also intact. And now I'm going to just quickly assess for pupil accommodation. Perfect. So pupil accommodation is intact, and while I'm here, I'm going to take a quick look at the sclera conjunctiva. Now look at his eyes. Okay, so no discharge or lesions noted. and the coloring looks nice and white. So now we're going to test cranial nerve number 5, trigeminal. So beginning with the sensory portion of cranial nerve number 5, I'm going to have you close your eyes and let me know where I'm touching you.
Cheek, cheek, forehead, nose, chin.
Okay, perfect. And now we're going to do the motor portion of cranial nerve number 5, trigeminal. Can you bite down for me? Okay, good. The masseter muscle feels nice and strong. And now we're going to do cranial nerve number 8, auditory. So we're going to do a series of tests using this tuning fork. So you're going to let me know what ear you can hear better in, or if it's equal in both.
Equal in both.
Perfect. And now we're going to, so that was the Weber test. Now we're going to do the Rhine test. I'm going to hold this up to you. You're going to let me know when you stop hearing it, then I'll move it, and you're going to let me know when you stop hearing the noise again.
Stop. Stop.
Perfect.
Stop. Stop.
Perfect. So air conduction is greater than bone conduction. Now we're going to be doing the whisper test. So cover the ear that we're not using, okay? We'll start with the right one. Repeat back what I say.
1, 2, 3.
Perfect. And now the other ear.
A, B, C.
Okay, perfect. So cranial nerve number 8, auditory is intact. Now I'm going to be assessing the mouth. I'm going to be looking at the lips, the gums, the buccal mucosa. I'm going to be looking at the tongue, underneath the tongue. I'm going to be looking at the salivary ducts and the floor of the mouth. So can you open up nice and wide for me? Can I have you stick your tongue out and say ah? Okay, so cranial nerve number 9, glossopharyngeal, and cranial nerve number 10, vagus, were intact. The soft palate and the uvula rose and fell symmetrically with phonation. Now I'm going to have you stick your tongue out and move it side to side. Okay, perfect. So cranial nerve number 12, hypoglossal, is intact. The tongue moved without fasciculations. When he said ah, I was able to see that the tonsillar grade was a 1, and there was no abnormal coloring inside the mouth. All of his teeth are intact, and there's no lesions or any abnormal findings. So now we're going to move on to the neck. I'm going to begin by feeling the carotid artery. Okay, perfect. And now I'm going to listen for any bruits in the carotid arteries. Okay, no bruits were heard. Now we're going to be assessing the thyroid gland, so I'm going to have you look forward. I'm going to move it to one side and then the other, and you're going to swallow, okay? Swallow. Perfect, and now again. Okay, good. So there's no abnormal swelling or anything with the thyroid gland. If there was, I would listen to it. Again, when I was looking at the neck, I noticed that the trachea is midline and symmetric, so no abnormal findings there. Now I'm going to have you turn around and I'll start the posterior chest portion of the assessment. So with breathing, I'm just making sure that he wasn't using any accessory muscles as we've been going throughout this assessment. No tripod positioning, no cyanosis in the skin or the lips, no use of accessory muscles. So now we're going to listen. Take big deep breaths in and out for me, okay? Okay, perfect. All lobes were heard, no adventitious sounds. Now I'm going to percuss. Okay, perfect. And now we're going to test agophony. So I'm going to have you say the letter E every time you feel my stethoscope move, okay?
E, 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 E.
Okay, perfect. And now we're going to do bronchophony. So we're going to have you say the word 99 every time I move my stethoscope.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, perfect. Now we're going to do whisper pectoraliquy. So I'm going to have you whisper the word 99 every time I move my stethoscope. Okay, perfect. So no abnormal sounds were heard. Now I'm going to do tactile fremitus. So I'm going to have you say the words 99 again every time I move my palms.
99, 99, 99, 99, 99.
Okay, that was felt equally throughout. Now I'm going to be doing CVA tenderness, assessing for CVA tenderness. So at the bottom of the 12th rib in the costal vertebral angle. Any pain with that?
No.
Okay, perfect. So I'm going to have you turn around again. We're going to finish the respiratory assessment. So I'm going to listen again to your lungs really quick. So take big breaths in for me. Okay, perfect. And now we're going to do tactile fremitus on the front again. So can you say the word 99?
99, 99, 99, 99.
Okay, perfect. Now we're going to feel for equal chest expansion. Can you take a big breath in and out? Okay, perfect. So that was equal. Now we're going to be moving on to the cardiac portion. I'm going to begin by listening to all 5 cardiac points. In the second right intercostal space, I'm going to listen for the aortic valve. On the left second intercostal space, I'm going to be listening for the pulmonic valve. In the third left intercostal space, we're going to be listening for Erb's point. In the fourth intercostal left space, we're going to be listening for the aortic valve, and then the mitral valve in the fifth midclavicular left intercostal space. So I'm going to begin with the diaphragm of my stethoscope. So again, aortic, pulmonic, Erb's, tricuspid, and mitral. And now with the bell, aortic, pulmonic, Erb's point, tricuspid, mitral. And now I'm going to be listening at the apex for a full minute to hear rate and rhythm of the heart. Okay, it feels, or it sounds regular. And now we're going to be feeling at the maximal point of impact. Okay, perfect. Now I'm going to have you lay at a 45-degree angle. I'm going to be assessing for any jugular vein distension, any heaves or lifts in the chest, which I don't see any. And now I'm going to be feeling for any thrills in all 5 cardiac points. Okay, perfect, none were felt. So now we're going to do the abdomen portion while I have him here. I'm going to lay you nice and flat. Can I have you scoot up a little bit? Okay, I'm going to be looking for any contours or asymmetry in the chest, any obvious masses or lesions, which I don't see any. And now I'm going to be listening for the major arteries in the abdomen, beginning with the aorta and the renal and the iliac and the femoral. Okay, no bruits were heard. And now I'm going to be listening for vowel sounds in all 4 quadrants, beginning with the right lower quadrant and moving counterclockwise. Wait, is that counter? That's clockwise, I think. Now I'm going to be palpating the abdomen, again beginning with the right lower. Vowel sounds were normal active. Okay, and you know what? Normally I would actually percuss before I start palpating, so I'm going to percuss really quick. Okay, perfect. And now I'm going to do deep palpation and feel for any masses or deformities in the abdomen, and then I'm also going to be feeling for the spleen and the liver. Okay, any tenderness with any of that?
No.
Okay, and the spleen was not palpable. Okay, so I'm going to have you stand back up and move into this chair again. Now I'm going to be doing the otoscope and ophthalmoscope really quick because I skipped that portion earlier. So I'm going to be assessing for the red light reflex, so just look at me. Okay, red light reflex is equal in both eyes. And now I'm going to be looking into the auditory canal and looking for the tympanic membrane, or looking at it. Okay, pearly gray, translucent. Okay, and again, pearly gray and translucent, and no abnormal findings in the ear canal. Okay, so now we're going to be moving on to the musculoskeletal portion of this assessment. So I'm going to begin by assessing all of the joints, beginning with the fingers, then the wrists, the elbows, and the shoulders. We're going to be looking for symmetry in the joints. We're going to be asking for any tenderness that's felt, looking for any redness, swelling, any deformities. Can I have you? Any tenderness with any of this?
No.
Okay. I'm going to feel the pulses while I'm here. Radial pulses are +2, easily felt and equal. Elbow joints and shoulders. Okay. Any tenderness with any of that?
No.
Okay. I'm going to start with range of motion in the fingers. Okay, so just follow what I do. We're going to abduct the fingers and adduct, flex them, extend them, and hyperextend them. Perfect. And we're going to do ulnar opposition. So pinky, yep, perfect. And now with the wrist, we're going to flex them, extend them, hyperextend them. We're going to ulnar deviate and radial deviate. Perfect. And now we're going to circumduct the wrists. Perfect. Any tenderness with any of that? Okay, now the elbows, you're going to flex them in, and you're going to extend them and hyperextend them if you can. Perfect. Now pull them up to me, and we're going to assess the strength. So pull me towards you. Good. Now push me away. Okay, 5 out of 5 strength there. Now with the shoulder joints, we're going to abduct. Okay, and now abduct, bring them down. Perfect. And we're going to do the inversion and exversion, inversion and exversion. And now the other way. Sorry, internal and external rotation. Perfect. Any tenderness with any of that?
No.
Okay. Now have you put your arms back out for me, and we're going to do the shoulder girdle. So I'm going to have you push your arms up against my. Perfect. Now push down. Okay. 5 out of 5 strength there, and you're going to circumduct those. So twist them. Yep. While you're there. Any tenderness with any of that? Okay. Perfect. You can put them down. And now we're going to do cranial nerve number 11, spinal accessory. Can you shrug your shoulders up against my hands? Okay, good, nice and strong. So now we're going to move on to the lower extremities. I'm going to assess the toes, the ankles, the knees, and the hips, again for symmetry, any tenderness, any swelling, any redness, any asymmetry in the joints. Okay, which I don't feel any. So beginning with the toes, you're gonna abduct them, kind of same with the hands, abduct and adduct, and then flex them, and then extend them, and hyperextend them if you can. Perfect, and now I'm gonna feel for the dorsal pedis pulses and the post-tibial pulses. Okay, nice and strong. No edema down here. And now you're going to range of motion in your ankles, so flex them down for me. So plantar flex, dorsiflex up, and we're going to invert them, and then exvert them. Perfect, and then circumduct your joints. Okay, perfect. Any tenderness with any of that?
No.
Okay, now the strength in the knees. I'm gonna have you kick out against my hands with both. There you go, now pull me towards you. Okay, good. Nice, 5 out of 5 strength there. And then strengthen the hips. Can you push out against my hands? Perfect, now push in. Okay, good, 5 out of 5 strength there. Now we're gonna stand up and do range of motion in the knees and the hips. I'm gonna have you face that way. So you're gonna flex your knee back and then extend it out. Okay, and now same with the other side. And extend and hyperextend. Perfect, and now with the hips, you're gonna flex forward. Flex your hip forward like that. Now extend back and hyperextend. Perfect. And you're gonna abduct and then adduct and circumduct. Circle if you can. Perfect. Now the same with the left side. You're going to flex forward and then extend back and hyperextend. And then abduct in and then adduct out. Or sorry, abduct out, adduct in. And now circumduct while it's out there. Perfect. Now we're going to assess the spine, looking for any scoliosis. So I'm going to be looking at the curvature and alignment of the spine. Can you flex forward? There you go. Now slowly come on up. Okay, I'm looking for the symmetry of the spine. Looks nice and straight. Now you're going to extend backwards towards me as far as you can. Perfect. Now stand up. And we're going to lateral flex to the right. Perfect. Keeping your hips nice and straight. And now to the left. Perfect. And then we're going to rotate to the right. Perfect. And now to the left. Awesome. Now we're going to do the same with the cervical neck. So flex forward for me. Perfect. Slowly come on up. Good. Now extend backwards. Okay. Now extend up. And then lateral flexion to the right. Now to the left. And then circumduct for me. Perfect. We're going to turn around and we're going to do the Romberg test. So close your eyes. Can you put your arms out like a T and stand there? Perfect, no swaying. And now we're gonna have you walk normally towards the camera. And now turn around and tandem walk back, heel toe. Okay, perfect. Now we're just going to finish off a few tests. So I'm gonna have you sit back down. We're going to begin with the reflexes, deep tendon reflexes. So we're going to do brachial. And then the radiocephalic. And then the tricep. Perfect. And now we're going to do the patellar. And then the Achilles. And the Babinski. Okay, perfect. And now we are going to do vibratory sensation. We're going to start with the ulnar. Ulnar prominence, so let me know if you can feel this.
Yes. Yes.
And then the medial malleolus.
Yes. Yes.
Okay. And now we're going to be doing soft touch. So close your eyes again and let me know where I'm touching you.
Right arm, left leg, right leg.
Okay, perfect. We're going to be testing for graphesthesia and stereogenesis. So with stereogenesis, we're going to have you flip your palms out. Tell me what I'm placing in your hand.
paperclip,
Okay,
coin,
perfect. And graphesthesia, you're gonna let me know what I'm writing in the palm of your hand.
O, Q,
Okay. And I think that is it for my head to toe assessment. Thank you.